Hello, welcome to another toe lift video. In this video, I'm going to be talking about one of the reasons that ladies develop these hypertrophic scars on the tops of the toes. Now, this often happens to Afro-Caribbeans and South Asian females, and this is a story I normally hear. I was fine in primary school. I started secondary school or college, and I started wearing a shoe like this. Soon after that, I started to put my foot into there, and guess what happens? There's not enough space, so your toes have to squash up, and I'm going to show you what it looks like on x-ray. When your toes squash up, your toes do that. They rub against the top of the shoe. It's either this kind of shoe or these flat dolly shoes, which I'll also put a picture of. It's one of those shoes, and that rubs against the shoe, and often the females think it's a corn. Then they go to Boots or they go to the GP. The GP gives them a salicylic acid cream, or they go into the pharmacy and they get a corn pad or a corn cream, put it on top, and that's when it happens. That's when you develop these hypertrophic scars and you damage the skin. Now, when you damage Afro-Caribbean and South Asian skin, it doesn't heal very well. There are a lot of positive things about having black and brown skin. One of the ones that it's not is that when we scar, and it's hard to diminish those scars, unlike Caucasian skin. One of the other things I often find is, and I'll put up a picture, is the second toe is bigger than the first toe, which is called a Morton's toe. Very common, almost 40–50% of females can have this. But when an Afro-Caribbean and South Asian woman has this, and you put your foot into a shoe like this, what's gonna happen to that toe? It's gonna buckle, because shoes are not designed, well, definitely not this one anyway. Shoes generally are not designed for the second toe being bigger than the first. So when it buckles, it rubs against the top and then causes the hypertrophic scars. Now, I have treated hundreds of females now from all over the world. Well, before the COVID lockdown, they were coming from everywhere. A lot from South Africa, actually, and from Belgium and other parts of the world. I have found that the toe lift procedure works really well, and I've changed it a little bit. So we've started to add laser into after 3 to 4 months. But the results can be unpredictable because we don't know how much damage is being done to the skin and what type of hypertrophic scar there is. There are some ladies where I will treat all the toes the same. All of them will get better except for one toe. And I really, hand on my heart, don't know why that toe hasn't recovered while the other 6 toes have recovered. I really don't know. It's very, very difficult. It's very, very difficult to treat scars. But I think we're doing a good job, and we are evolving as we go along. Let's see where the next couple of years take us. But yes, if you are wearing shoes like this, don't wear them. Don't wear them. And if you're wearing dolly shoes, don't wear those. They're bad for you. Thank you for watching.